Hello, everyone. Welcome to my channel, Learn Facial Aesthetics. And this is a new series and a new season. We are beginning the eyes and the periorbital region. And the reason why I'm doing this is that it is most requested by the students with whom I have in my course. And also 90 to 95% of the individuals walking into aesthetic clinics have concerns in and around the periorbital area. And this area being the most sensitive and being showing the earliest signs of aging, it's a matter of concern to almost all the age groups, starting from the school going children to the senior age groups. Periorbital region is a matter of concerns to most of the individuals. So, which is why I started, doing this series. So, I'm Dr. Bhavna Agarwal, a facial aesthetic consultant, a beauty psychologist, and aesthetic physician practicing in the Pink City of Jaipur since the last 20 years. And I'm doing exclusive facial aesthetics. So, without further ado, let's get started. So, eyes and the periorbital region, this is an introductory video in which I will be telling what is the importance and how to go about analyzing and dealing with the periorbital area. So the eyes play a pivotal role in facial aesthetics, and they have a significant impact on the overall appearance and the expression of the face. Now, considering that it is the focal point of the face, because when you talk to someone, you are directly looking into the eyes, and the area around the periorbital areas does also come into the area of focus while you're talking. So they are the windows to the soul, they say, but the periorbital area is a reflection to a much wider aspects. For example, appearance, emotions, expressions, personality, age, health, all these factors can be assessed just by looking at the eyes and the periorbital area. So why is it that this area is so challenging to deal with? Now, it's because the skin around the eyes is very thin. It is the thinnest in the entire body. The lack of underlying support, like the facial fat pad and all that support, is very minimal underlying the skin. And the treatment modalities are minimal, and there are certain restrictions to to the extent to which we can use those modalities in these areas. So which is why it makes it very challenging to deal with this. Now, there are multiple ways in which eyebrows are important, So here in this video, we will be discussing the aesthetic concerns, which are more relevant for the aesthetic or the functional aspects of the eyebrows. There are many other aspects which won't be relevant to this video, so I won't be going into that. The function of the eyebrows, they're relevant to aesthetics, only those will be discussed. So first is the facial expression. Now, this plays a crucial role in conveying emotions and expression. And raised eyebrows can indicate surprise. Furrowed eyebrows, they might signal concern or anger. So just by changing the shape and position of your eyebrows, the entire facial expression changes. So which is why it is very important when it comes to facial aesthetics, when it comes to your expressions, when it comes to your emotions. So this is how, just by changing the shape of the eyebrows and the position of the eyebrows, the entire, expression can change, ranging from, surprise, dismay, despair to anger. It could be anything, even surprise. So the resting expression of the upper face is primarily contributed by the shape and position of the eyebrows. This is the first aesthetic concern. Now, brow ptosis is something which happens when the shape and the position of the eyebrows is changing with age or with any other issues. So it could be medial brow ptosis, it could be lateral brow ptosis. Now, it could be upper eyelid hooding, because when there is brow ptosis, the upper eyelid has a tendency to bulge out, which is called as the upper eye hooding. There could be glabular frown lines, and there can be hyperkinetic brows, which we will be discussing in the functional aspects later in the videos. So these are the various aspects which are concerned with the eyebrow shape and position. The second aspect is communication. So the eyebrows also aid in non-verbal communication, like they add, that extra hint of expression to your communication. The subtle movements or gestures while the eyebrows can convey, like agreement, skepticism, curiosity, surprise, question, dismay, all those things. So that is why they, play an important role in communication, because while you are communicating, you are expressing your emotions, and your expressions are very important to give that tone to your communication. And that is why eyebrows play an important role. And when the shape, position, size, all these are changing of the eyebrows, the meanings of everything, gets changed accordingly. So third aspect is the cosmetic enhancement. Obviously, they contribute to facial symmetry, aesthetics, influencing one's appearance. They're framing the eyes. In fact, they frame the shape also of the face. So cosmetic enhancement is the third reason. And self-confidence, of course, well-groomed eyebrows can boost your self-confidence and contribute to individuals' self-image and esteem, and that is why they're very important. So this is the fourth aspect, which is relevant to the aesthetics of the eyebrows. Now, there are subtle indicators of eyebrow rejuvenation. Now, people might not know that they need eyebrow rejuvenation, but you might find them telling a few things, and which could be hints that they need eyebrow rejuvenation or periorbital rejuvenation on the whole. So, first of all, there might be emotional paradox, some people might be able to relate that when they look at their photos, they find themselves very sad, and they're very surprised to look at their photos and say, oh no, I was feeling happy that time, but why am I looking sad? Why am I not looking the way I was feeling? That is called the emotional paradox, and sorry, and that is called emotional paradox. And this is something very common which people find, but they don't know that solution might be in the eyebrow rejuvenation. So you might find yourself wondering, I look sad in photos even though I was feeling great. Now, second thing which could be an indicator is that frequent headaches or eye strain. Now, people with age, the eyebrow is drooping, as a result of which they experience frequent headaches or eye strain, which might be linked to the strain caused by the lifting of the brow muscles to compensate for the sagging brows, because they are affecting your visual field or vision in some way or the other. So that is the second hint by which you can just make out or figure out whether this could or could not be related to the brow ptosis. The third is sensation of the hooded eyes. Like they describe, feeling heavy on the upper eyelid, or they find it, feeling heavy around the eyes, like, which this might obstruct their vision also sometimes in severe cases. So sensation of hooded eyes is a third indication, which is a subtle sign that something has to be, done around the eyebrows. Now, upper eyelid makeup is not visible. When they, especially in women, when they apply makeup over the eyeshadows over the upper eyelid, that eyeshadow is not visible, it goes inside. That is also one of the, findings which can be indicating that you need to do something with your brows. Or you might find them complaining that the eyeliner, whenever they apply eyeliner, it gets stuck on the upper eyelid. So that is another sign. Then some individuals might have facial expression concerns, feeling that their natural facial expression appears stern or unfriendly because of the furrowed brows caused by excessive skin or muscle tension. And these complaints, they often point indirectly to issues that could be addressed through a brow lift procedure. And these can help individuals achieve a more refreshed look, alert and youthful appearance by lifting and repositioning the brows. Now, the second is the thickness or the density of the hair in the eyebrows. That also decreases over time. So eyebrow thickness is subjective, but it is preferred to be fuller at the beginning, that is close to the nose, and gradually it tapers thinner towards the tail, that is outer edge of the eye. However, the ideal thickness, it may vary from individual to individual, and people might have, different preferences for themselves. So the need to use a brow pencil frequently. So if someone is using brow pencil on everyday basis, especially women, that indicates that, something has to be done with the density of the brow. Eyebrow is not visible in photos. This happens both with men and women, but women have the, tricks and techniques to compensate for this, but men don't. They feel that when they look at their photos, their eyebrows are not visible, which is why they find that the face is expressionless in photos, or they are not able to relate the expression in the photos with themselves. So that is one more, subtle sign. So finding oneself expressionless in the photos is fun. Looking tired despite sleeping well. People might tell you that, why are you always looking tired? So this is another indication that something around the eyebrow needs to be, worked up. Avoiding a full-hearted smile. Now, there are some people, this is more related to the crow's feet or the lateral canthal lines, which I'm talking about, that people find that when they smile, these lines appear, the crow's feet appear on a full smile. So, and that makes them look older in pictures, especially we smile, when we are taking pictures, especially the, profile pics. So they find themselves a little elderly in the pictures, and then they finally figure out, like, people are smart, they figure out that it's because of the wrinkles which are forming around the eyes while they smile. So they avoid smiling, making a full-hearted smile while taking pictures, or they will smile, they'll keep their smile horizontal so that the wrinkles are not formed. So that is another subtle sign that periorbital rejuvenation has to be undertaken. Using multiple tools like ice roller and under eye creams, people find, to compensate for all these changes, people will find working around with tools. They're always working around with ice rollers or ice cubes or icing to reduce the puffiness or to reduce the wrinkles, to rejuvenate the eye area. They're using multiple under eye creams. So there are a lot of options available nowadays. And we are exposed to a lot of knowledge and information, which works for some, which doesn't work for some, but these people seem to be trying almost everything. Another indication, subtle indication that periorbital rejuvenation needs to be undertaken is that women, especially, they are consistently dissatisfied with their brow shape. They're always fighting with their beautician, asking for a good shape, or a lifted shape or a better arch, and they're never satisfied with it. So now, considering all these changes, we can narrow down the multiple aesthetic concerns in the periorbital region, which can be any of the above. So it could be loss of eyebrows, it could be senile brow ptosis, which could be medial or lateral, it could be upper eyelid hooding, lower eyelid bags, lower eyelid puffiness, lateral canthal lines, teardrop deformity, under eye dark circles, RSTL in the lower eyelid, that is the resting skin tension lines, which are mostly wrongly interpreted as the under eye wrinkles, poor skin quality, and scleral show. So these is the entire gamut of indications which the periorbital region gets affected with. In isolation or in combination, they could be, present from anywhere to end. Here I forgot to mention the festoon or the malar mound. That is also an under eye area, although it is present at the lid cheek junction. But yes, it can be, it is a periorbital region concern. Now, as a facial aesthetic consultant, understanding the significance of enhancing this region is important, which we've already done. You have to aim to achieve comprehensive facial harmony and rejuvenation, and aim to give a youthful and rejuvenated appearance, which can be sustained for a longer time. So the first step is identify the concerns. Step 2 is identify the challenges the person is facing because of that concern. Step 3 is identify the etiology, that is the underlying factors, the anatomical factors, the lifestyle factors, the behavioral factors contributing to that particular concern. Step 4 is to design a comprehensive plan. Step 5 is to align it to the objectives of the patient. Step 6 is explain and discuss the commercials. Step 7 is execute the plan. Step 8 is always do follow-up. And this is something we lack during our initial years, especially beginner injectors. They do not do the follow-up. They are scared of follow-up. So do not be scared of follow-up. It is the most important aspect of your treatment plan. So the various aspects which could be influencing any aesthetic concern, beside the periorbital, any aesthetic concern can be influenced by the age, the gender, the cultural ethnicity, current fashion trends. But most important is the personal preferences. For example, if there is a person who has unibrow, but they are very happy with their unibrow. So in that case, nothing will be applied. So the personal preference is above all. It is above your, all the theories, all the ratios and proportions. If someone is happy with their appearance and they do not want to do anything about uh, it is best to leave it like that. So the personal preference tops the chart. And then if they have a concern that needs to be worked around and they want to work around it with it, you can always go ahead with it. So this was in general about the periorbital region. What are the concerns? How do they bother the individuals? And why is it important to deal with them? So this was a short introductory video. The next video that I will be doing will be on the normal eyebrow aesthetics. Although it is very difficult to define normal, but still, when you are treating something, you have to have some guidelines to start with, a reference point to start with. So the next video will be on the eyebrow aesthetics. And till then, do share your thoughts, do share your opinions, and do share your questions, and do share the topics that you find challenging, and I'll be doing videos on them. And for any inquiries, it's best to do a WhatsApp only. I wouldn't, take any calls. I wouldn't be able to take calls. And for trainings offline and online, I'm always available on WhatsApp. So thank you for watching, and bye for next time.